is Sabrina Crane. Today I'm going to talk about the skeletal system. I'll cover the components, the classification of bones by their shape, the axial skeleton, the appendicular skeleton, as well as talk about the clinical use or application of this information. All right, starting off with the components, the skeletal system includes the bones, obviously, cartilages, joints, ligaments, and your bone marrow. You have two different kinds of bone marrow. There's red and yellow. Your red bone marrow is the primary site for blood cell production, and then the yellow bone marrow is kind of the energy reserve of fat cells. And then your ligaments connect bone to bone, bone to cartilage, cartilage to cartilage, and then you have three different kinds of joints. You have synarthrosis joints, amphiarthrosis joints, and diarthrosis joints. Synarthrosis joints don't move at all. It's like the joints in your skull, those suture joints, very fibrous. You don't want them to move at all. They don't move. You have amphiarthrosis joints that are typically held together with hyaline or fibrous cartilage or ligaments. Your pubic symphysis is a good example of an amphiarthrosis joint. They just move a little bit, not very much though. And then you have diarthrosis joints, which are your synovial joints, the ones that allow movement in your arms, your shoulders, all of your synovial joints. Your bones themselves are a supportive connective tissue, also known as osseous tissue. There are four different kinds of cells in mature bone cells. You have osteoblasts, which are responsible for osteogenesis. They build bone by secreting organic components of bone. Then they are immature bone cells. And then you have osteocytes, which are mature bone cells, and they are responsible for maintaining the bony matrix. They break down and rebuild it. You have osteoclasts, which are responsible for osteolysis. They break down bone. In doing so, they release calcium and phosphate and increase the concentration in bodily fluids of those two compounds. And then you have osteoprogenitor cells. Those are stem cells that divide, and those daughter cells become osteoblasts. Moving on to the categorization by shape, you have sutural bones, which are found along the suture lines between flat bones. They're small, irregular shaped bones. You have flat bones, which are in your skull. They're pretty thin. Typically, they have parallel layers of compact bone with spongy bone in the middle, kind of like a little spongy bone sandwich. You have pneumatized bone, which have air pockets or have hollow holes through them, like your ethmoid bone. And then there are long bones. They are longer than they are wide. They have an epiphysis on both ends, a metaphysis right above, or I guess right above, right below, right next to the epiphysis. And then the diaphysis is the center long part, and that is also where the medullary cavity is. Then you have short bones. Your wrists and your ankles are perfect examples of these. They are box-like bones that are covered in compact bone with spongy bone in the middle. And then you have irregular shaped bones, which is like the spinal column, the pelvis. They're just kind of a weird shape. They don't really fall into the other categories. And then you have your sesamoid bones, like your patella. These are small, round, flat bones that grow inside of tendons near joints. Sometimes people can have sesamoid bones near their thumbs or their toes. I believe that is all of the shapes. Moving on to the axial and appendicular skeleton, there are 80 bones in the axial skeleton and 126 bones in the appendicular skeleton. The axial skeleton includes the skull, the rib cage, the sternum, the thoracic, but the entire spinal column, and the hyoid bone and the auditory ossicles. You cannot see the hyoid bone because it is actually the only bone that does not touch any other bones. It would be right here, but it's not on the skeleton. It actually is suspended by a ligament from the styloid process of the temporal bone. It is the anchoring spot for like tongue muscles and some ligaments in the larynx. And then the auditory ossicle, you have 6 of them. You can't see them because they are actually encased in the petrous area of the temporal bone, about right there. But going through the names of all the bones, you have your maxilla right here, and then the palatine bone that articulates with the maxilla. And then you have the nasal bone and inferior nasal concha would be right in here, but it's not actually on this skeleton. They articulate with the maxilla and the palatine bone. And then you have your zygomatic bone right here. Maybe I should look at it. And then your lacrimal bone is right here. It makes up your eye socket. And then your vomer is the inferior part of your nasal septum, and then the ethmoid bone is right above that. If you saw a sagittal view of the skull, you would see those a lot easier. And then you have the mandible, and the sphenoid is right in here. It's kind of hard to see, but your sphenoid's right there. And then moving on, you have the frontal bone, the two parietal bones, your two temporal bones on either side, and then the occipital bone. And then the spinal column, you have 7 cervical vertebrae, 12 thoracic, and 5 lumbar. Your C1 and C2 are actually the only vertebrae that actually have other names. So C1 is also known as the axis, and C2 is the atlas, and then it goes from 1 to 7. The thoracic spine is in a similar fashion. It goes T1 to T12, and then the lumbar is very similar, L1 to L5, and then you have your sacrum and your coccyx. Moving them to the front, all of your thoracic vertebrae articulate with your ribs. You have 12 sets. The first 7 are your true ribs, and they articulate also with the sternum. Top right above the sternum is the manubrium, and this is the xiphoid tip, or the xiphoid process. Going back to the ribs, 8 through 10 are considered false ribs, and then 11 and 12 are actually floating ribs. And I believe that is all of the axial skeleton. Yes, and then you have your appendicular skeleton, so your pectoral girdles, your pelvic girdle, your upper and lower limbs. Starting at the top, you have your scapula, your humerus, your clavicle here, your radius and your ulna, and then in the wrist here, you have starting proximal. You have the scaphoid, the scaphoid, lunate, triquetrum, and the pisiform, and then going distal, you have the trapezium, the trapezoid, capitate, and the hamate, and then those articulate with the metatarsals. With the metacarpals, the metatarsals are in the foot. Metacarpals, and then the metacarpals articulate with the proximal phalanx. The first phalanx actually only has proximal and distal phalanx, and then 2 through 5 have a middle phalanx and the distal phalanx. And the foot is very similar setup. Your first phalanx only has a proximal and distal phalanx, and then 2 through 5 has a proximal, middle, and distal phalanx. And then these articulate with the metatarsals. And then moving the foot onto the top so you can kind of see this a little better. You have 3 cuneiform bones. Flip this over. You have the lateral cuneiform, the intermediate, and the medial cuneiform. And then you have the navicular, the cuboid. The cuboid is over here. Cuboid. And then the talus and the calcaneus, which is your heel, your tibia, your fibula, your patella, your femur, and then your pelvis is actually split up into 3 different parts. You have your ilium wings, your pubis right here, and then this back section here is your ischium. And I believe that is all of the bones. I hope it's all of the bones. The clinical use for bones is very important. Your skeletal system is literally the structure of your body. It stores minerals, it's important for blood production, and it allows you to move. I'm actually an x-ray tech, so I look at the skeletal system constantly, and I'm actually very interested in it. Moving forward in my medical career, I want to stick with the skeletal system and potentially go into orthopedics, so it is very important that I understand how the skeletal system works and all of the components of it. Thank you for watching my video.